Hello, welcome everyone to the importance of incorporating equality, diversity and inclusion, EDI, in patient and public involvement. My name is Linda Onerime Prince and I'm the Patient and Public Involvement Manager at the NIHR Academy. I'll pass you on to my colleague Sylvia to introduce herself.
Good afternoon, everyone. I'm Sylvia Bortoli, and I'm Senior Public Involvement Manager at the NIHR Centre for Engagement and Dissemination.
Thank you, Sylvia. I'll also pass you on to Sophia, my next colleague.
Hi, an Inclusion Manager at NIHR.
Thank you, Sophia. So I will thank you all. And also just to let you know, we'll also have a public contributor later on in the webinar and also a research staff perspective as well, who would give both their perspective in terms of EDI in PPI. Okay, so in today's webinar, we'll be covering what is patient and public involvement and expectations of PPI from NIHR, what is EDI, the importance of EDI in PPI, the barriers to incorporating EDI in PPI and how to overcome them. And as I mentioned earlier, we'll be hearing from a research staff and a public contributor in terms of their perspective in incorporating EDI and PPI. And then now I want to run another poll because I think it'll be important for us to understand if you are, how confident you are in incorporating EDI to PPI. So a poll will come up if you could please answer. So 24% feel they're not very confident. Some 27 feel slightly confident. 28% feel somewhat confident, and 17% feel fairly confident. So the intention is that at the end of this webinar, that you all feel more confident in incorporating EDI to PPI. So thank you for completing that poll. What is patient and public involvement? NIHR defines patient and public involvement in research as research being carried out with or by members of the public rather than to, about, or for them. So you can clearly see that this is very much a partnership. And it's also very important to distinguish between involvement, participation, and engagement. Involvement is where members of the public are actively involved in research projects. So for instance, members of the public are assisting the researcher to develop patient information leaflets on the research, so contribute to the content and designing. Participation is when members of the public take part in research. So for instance, members of the public are asked to complete a questionnaire. So that's participation. And then engagement is when members of the public are given information and knowledge about a research. So this is where, for instance, a researcher may want to share the result findings of a research with members of the public, and this is called engagement. But in terms of patient and public involvement, this is quite important in distinguishing between the three. Next slide, please. Okay, in this slide, what are the expectations of PPI from NIHR? PPI is really at the core of what we do. So we really do value PPI, and we expect PPI in all the research that we fund. And in addition to this, NIHR's best research for breast health, which details our operating principles, our operating priorities, which include our strategic focus, operating principles, and our work stream. So in this document, we detail one of our work streams, which is to partner with patients, service users, and communities to improve the relevance and quality of impact of our research. So you can really see that PPI is very, very important within NIHR. And now I will now pass you on to my colleague, Sophia, who will be presenting on the next two slides.
So if we look at what is EDI, equality, diversity and inclusion, equality is about ensuring that everyone is given equal access.
Okay, we can't really clearly hear Sophia. So Sophia, if it's okay, I'll just read through your slides and then we can come back in terms of the Q&A. So this is what is EDI. Equality, ensuring that everyone is given equal access to resources and opportunities to utilize their skills and talents. Taking a systems approach to what we do and how we do it, and identifying and removing long-standing structural barriers to success. Diversity, being reflective of the wider community and having a diverse community with people from a broad range of backgrounds representing in all areas and at all levels. Next slide, please. And then more information about what EDI is. Inclusion, an approach where groups or individuals with different backgrounds are welcomed, culturally and socially accepted and treated equally. Engaging with each person as an individual and making colleagues feel valued is very important in terms of EDI. A sense of belonging that is respectful of people for who they are and feeling supported to enable us to do our best. And equity involves trying to understand and give people what they need to achieve their potential. So promoting notions of fairness, justice, entitlement, and rights. So please go into the next slide. The importance, now that we explained EDI, I will now focus on the importance of EDI in patient and public involvement at NIHR Academy. So as detailed in the NIHR's Best Research for Best Health, we are guided by 5 operating principles, and one of those principles is inclusion. Inclusion is really very important to us because we are committed to EDI and our research is shaped by diverse communities. So we develop researchers from diverse backgrounds and multiple disciplines. So with inclusion being one of our 5 operating principles, that's another emphasis on why EDI is important at NIHR. In addition to the above, one of the areas of our strategic focus is to embed equality, diversity, and inclusion across our research systems and our culture. So it's a running theme within NIHR, how EDI is very, very important, not just EDI as a whole, but EDI within PPI. So now that I've now established the importance of EDI and PPI, I will now discuss the importance of EDI in research. Next slide, please. In this slide, so NIHR's Include project, which is provides tools and roadmap to improve inclusion of underserved groups in clinical research. So there's actually a dedicated website, which we'll put a link to, which all the attendees can go to after the webinar, and it details the framework they use and different resources in terms of making research more inclusive. So the Include in project guidance suggests the below points for the importance of EDI in PPI and including underserved groups. So these points address failing to include a broad range of participants means that results may not be generalized. Very, very important, because if you only include a small section or of the population, then you cannot really generalize your research to the whole. So it's very important to include diverse groups and in your research, just so to make it more general. Different groups may respond differently to an intervention, again, depending on disease state. This is another important point. So when you only just focus on one group, it may not be applicable to the population as a whole. So it's important to focus on different diverse groups. If clinicians lack evidence of the effect of an intervention for a particular group, they may be reluctant to offer the intervention to that group. Yes, so if they haven't considered if the researchers haven't considered a particularly ethnic minority group, then it would be harder to say, well, this would then affect everyone else. And then the other point mentioned, unless we have tested if an intervention can be deployed effectively to different groups, we cannot be sure that it will work in the first place. Again, these are one of the points, making sure that when you do have different groups, then it becomes more applicable to the population as a whole. Next slide, please. Okay, what are underserved communities in research? The include chorus says there's no single definition for an underserved groups, but these are some of the points that are highlighted that to consider. So, for instance, lower inclusion in research than one would expect from a population. So if, for instance, a particular ethnic minority group is not engaging in research, one could say that they are underserved community in terms of research. The other point is higher healthcare burden that's not matched by the volume of research designed for that group. Again, that's not another important point. And the third is important differences in how a group responds to or engages with healthcare interventions compared to other group. So these are some of the points that an Include project have listed in terms of what an underserved community is in research. So I will now pass you on to our public contributor, Angela, who would discuss from her perspective the importance of EDI in PPI.
Hello. Yes, my name's Angela. I've thought I'd just give a very small background as to where I come from. I was born in London. I moved to Manchester in 1984, long time ago, and I became interested in health research following experience that I've had in my own family with areas such as diabetes and dementia. I think a lot of public contributors have started off that way because of personal experience, obviously possibly with a condition or as a carer. And that was my background. But I was also finding, particularly with dealing with elderly parents, that I was having to act as an advocate and explain perhaps to health professionals about the issues that they face, which they weren't necessarily aware of. Things like lifestyle, diet, areas that in my particular family, which has an Afro-Caribbean background, might be different to other groups. Now, this was some 10 years ago when I was involved in that with my now late mother and father. But I ended up joining a diabetes research group, and then I moved on to broader groups. One in particular I was involved in related to primary health, primary care, and I was involved in working with researchers who were developing work around the primary care sector. So I've since been involved now, I think, for about 10, 11 years, and I've been involved in a number of projects. The most satisfaction I think I've had is where I've been involved in the design, in the putting together plain English summary, in looking at results with researchers that actually mean something to me, where the research is in plain English, I think that's the word, and I'm able to understand it from a non-scientific lay point of view. Some of the things that perhaps have resonated with me have been things like something called speech study, which was looking at how elderly people with multiple health conditions can improve their ability to communicate with healthcare staff, and what healthcare staff can do to ensure that they encourage that communication. I've been involved in interviewing type 1 diabetes patients who have been successful in managing their condition and looking at tips. And what I found particularly gratifying is that those patients actually felt that they could perhaps share those thoughts and feelings they had with us as fellow patients and fellow users. The other area that I was involved in quite closely was developing guidelines and a handbook for patients in my area to use when visiting their GP. So they're able to put together their thoughts before they have interviews with the GP or the health professional, so that they can gather their thoughts beforehand. Now, in all those areas, I felt I had something that I could contribute, which was perhaps a different perspective from many of the other people in my group. As a woman of Afro-Caribbean origin, as an older woman now, a grandma, who recognises some of the issues perhaps elderly people now experience, and also as somebody who had carer responsibilities. So I think I had a perspective. I wouldn't say I was a representative. I think that is actually quite important. Nobody represents anybody in that sense. You are giving a perspective to the research study. I think as a public contributor, as a PPI representative, I think I can see how it can be difficult for people who perhaps aren't used to an academic background or higher education to necessarily contribute and be part of this. I wasn't aware that PPI representative existed before I retired, before I had time to look. And I think this is an issue that we do need to ensure happens, that we actually are able to recruit and able to encourage more people to act as PPI representatives. It's very, very important. We don't advertise like we do for volunteers in other areas, and this, I think, is something that we do need, I think, as both academics, researchers and lay people, to ensure that we are shining a light and encouraging more people to be involved. The other area that I'm particularly concerned about is how we ensure that we are speaking in a language that everybody understands, which is why it is really important that when people are doing research studies, that they're able to put it in plain English for people to understand, and they don't feel excluded because of the language that is being used. I think that's about it. Can I move back to Linda?
Thank you, Angela, for that perspective. It's really, really helpful. I will now pass on to Sylvia for the next slide. Next slide, please.
Thank you, Linda, and good afternoon, everyone. For those of you that missed the introduction at the start, I'm Sylvia, and I work for the NIHR Centre for Engagement and Dissemination. And I'm very excited to be here today, as this is a very important topic for us. Equality, diversity and inclusion is one of our 5 key priority areas of work at the Centre for Engagement and Dissemination. So I really value being part of this webinar. I'm going to present to you a summary of 2 resources and 1 piece of research, which will give you more information on the topic. I've seen a few questions in the Q&A wanting practical tips, so hopefully this will give you more information, which is kind of more practical. So I'm going to start by talking about the UK standards for public involvement, as they are my usual starting point when considering good public involvement. And there are 2 specific standards which I think speak particularly to incorporating EDI to PPI. The first one is inclusive opportunities, and to meet the standard, public involvement opportunities should be accessible and reach people and groups according to research needs. For example, it's important to consider any potential barriers to involvement, such as payment. Offering payment and or other appropriate reward for involvement is not only best practice, but also key to fostering meaningful relationships and breaking down involvement barriers. And after the presentation, we can share with you a link to the NIHR payment guidance, where you will find detailed information on the topic. Other barriers you might want to consider include whether meeting locations are accessible, or for online meetings, whether live captioning is available, or if language translation is required. The second standard, which is relevant here, is working together. And to meet this standard, you need to work together in a way that values all contributions and that builds and sustains mutually respectful and productive relationships. For example, defining the purpose of public involvement with those you involve is key from the very start, and there should be a shared understanding of roles, responsibilities, and expectations from the start as well. Next slide, please. At the NIHR Centre for Engagement and Dissemination, we're working on a themed review on the topic of how do we create patient and public participation, involvement and engagement in research that is genuinely inclusive. This work is still underway, but so far we found some interesting findings which I wanted to share with you. But first of all, what is a themed review? Themed reviews provide an overview of recent research on topics or themes that have been highlighted as being of interest by members of this community. And the topic of how to make research genuinely inclusive, as you can imagine, was very important. The review aims to provide recommendations for NIHR that can help ensure that patient and public participation, involvement and engagement in research it funds is genuinely inclusive. This is not aimed to be a systematic review, but rather a narrative review, which we hope will propel change. As part of this themed review, a literature review was undertaken by Shobha Dawson and Angela, who you've just heard from. The information was sourced through searching through literature, including systematic reviews, and also engagement with experts in the field. And as you can see from the slide, the following barriers were identified: funding and resources, including time and funding constraints, and also practical difficulties. There were cultural and attitudinal barriers identified, for example, low awareness of the importance of inclusive research, structural health inequalities and racism, distrust and power imbalance, and also barriers around knowledge and skills, for example, the use of technical language and jargon, but also sometimes researchers' lack of previous experience in the topic of equality, diversity and inclusion, or understanding of the research process. Next slide, please. What the literature review also found were examples of what potential enablers there could be to overcome the barriers identified. So, for example, regarding funding and resource barriers, there was evidence of using compensation for recognition and contribution. So what I was talking to you about earlier about payment, also the provision of transport, and also working with existing community groups or religious leaders to help with kind of taking the next step and on matters of resources as well. Around culture and attitudes, enablers found in the literature included bringing in structural issues of power to the conversation, so being transparent about those issues from the very start, and working actively to empower people and break down power differentials. And around knowledge and skills, some enablers identified in the literature included finding culturally appropriate solutions, for example, multilingual invitations and language, including, for example, bilingual researchers. Next slide, please. And finally, I wanted to run through 12 top tips. I know someone in the chat asked for 5, but this resource provides 12 top tips for being inclusive in public involvement in research. And it's based on this resource published by NIHR. The first tip is to check your power. Working with members of the public in research often operates in a context of imbalanced power relationships between the people involved, researchers and institutions. So try to understand the power relationships within your context, your role, and how to operate to promote inclusion. 2 is to value the people you work with. So to recognize and nurture the people who become involved in research. 3rd, use language carefully. As I mentioned before, good communication is very important, so avoiding jargon helps, but also agree on shared terminology that you all find is conducive to good partnerships. 4 is consider inclusive locations. Decide together with the public contributors that you involve when, where, and how public involvement can be most inclusive. 5, listen and seek agreement. So listen carefully, then act on what you've heard or give good reasons why you might not be able to. 6, get from A to B, perhaps via Z. At the beginning of working in partnership with members of the public, starting points might be different for different partners. So be prepared to maybe consider where other people are coming from and be flexible and allow time to find the right pathway together. Next slide, please. 7 is to collaborate, as well as individual people that you might involve. Many community organizations also have a huge amount of knowledge and expertise about public involvement. So understand and work with organizations to help enable communities to lead and own their own involvement in research. 8 is to invest in the workforce. This is maybe slightly more geared towards kind of higher level decision makers, but effective public involvement requires investment in potential, in personnel, and whether these are researchers or in defined practitioner roles, investment is really key. 9 is to commit to a relationship. Inclusive research often revolves around kind of really effective and mutually beneficial and meaningful relationships. It's important to acknowledge that things might not always go smoothly, and that sometimes things come to a natural or planned end. Evidence, evaluate, share, and reflect is the 10th tip. It's really important to capture and evaluate your public involvement and publish it if you can. Theory of change approaches can work well to evaluate involvement and help with establishing partnerships and a common purpose. 11 is to act small, think big. So support researchers, your colleagues, and members of the public to develop the confidence, learning, and skills to enable growth. And 12, be values-based and socially innovative. This is all about avoiding diversity and inclusion, becoming a tick box exercise by adopting a values and outcomes-based approach. Hopefully these 12 top tips were useful. If you wanted specific examples of how these principles were put into practice, you can read a companion document to this guidance, which is called A Practical Guide to Being Inclusive in Public Involvement in Health Research, Lessons Learned from the Reaching Out programme. And we can share all these links with you after the webinar. Thank you very much. And I'm going to pass over back to Linda now. Thank you. Next slide, please.
Thank you, Sylvia. Thanks for your section. So in this slide, I'll be discussing questions that research teams can ask themselves when designing inclusive research. Again, these questions were taken from the NIHR's Include project guidance and the information was sort of taken from there. So these are the questions you might want to consider. What are the characteristics and demographics of the population which your research looks to serve? Again, that's very, very important when designing your research to think about, okay, how do I address those, and to consider those two items. The next is, how will your inclusion stroke exclusion criteria enable your trial population to match the population that you aim to serve? So if you've actually taken the in terms of your trial population for your research, how will that amount serve the population in general? So this is another second important point. And the third is, justify any differences between your projected trial population and the population you aim to serve. So these are the questions you can ask yourself when designing inclusive research. Next slide, please. Further questions as well, and as I said, we will also put the link to all this in the materials we'll send, which will give you a comprehensive guide which includes these questions. How will your recruitment and retention measures engage with underserved groups? So when you're thinking of the different methods, you may need to target your recruitment and retention methods for the a particular ethnic minority group. So for instance, when you think of engagement with ethnic minorities and obviously adhering to COVID guidelines and COVID rules, or previously to COVID, you may think of when I was involved with terms of research, which under underserved communities, I would go to community centers or religious community groups. So it's also thinking about these things. How will I recruit different people to make my research more diverse? So think of various methods or various social media channels that you may also want to target. The next 2 points are, what evidence have you that your intervention is feasible and accessible to a broad range of patients in the populations that your research seeks to serve? And the third point you may want to consider, are your outcomes validated and relevant to a broad range of patients in the population that your research seeks to serve? So these are some of the questions, again, which will be put in the handouts we sent to you. Next slide, please. Okay, I will now pass you to our research staff who will give their feedback in terms of incorporating EDI to PPI. Hello. The pandemic has highlighted, sorry, am I visible? I'll carry on. Okay, the pandemic has highlighted the extent and harsh impact of health and care inequalities. But bridging the gap. Sorry, I think my picture hasn't come up, but I'll keep talking anyway. Bridging the gap and reducing preventable suffering is a longer term issue, which is very noticeable in South London, where where I'm the involvement coordinator for an applied research collaboration, ARC, where stark disadvantage and discrimination can be found side by side with prosperity. People with diverse backgrounds and identities should indeed be able to help shape health and social care research and have valuable insights to offer. But bringing in knowledge and insights of patients, service users, carers, and support givers, especially from underserved communities and local groups, can also help research to address inequalities more effectively. Some of the ways to make research projects and organisations more accessible and inviting and ensure that diverse public contributors are valued and respected have already been mentioned. In addition, having different routes into and levels of involvement can open this up more widely, and I'll give a couple of examples. The first is of work done with Stan Papoulias, done by Stan Papoulias and me in a previous research collaboration, Clark, South London, as it was known, from 2017 to 18, which helped to lead to ARC, the Applied Research Collaboration. And in the run-up to and at active involvement in Research Day 2018 with staff, public contributors and other local people, publicised using a database of local groups expanded to increase diversity, and in which creative facilitator Mary Robson, using maps from www.manualthinking.com, played a valued part. We recognise that many people and groups might not wish to or be able to be directly involved in research, but have views and experiences on health and social care related, for instance, to multimorbidity, often made worse by inequality, which might inform research priorities and questions. I found that in the previous couple of years, South London community and patient organisations had produced many reports which threw light on factors which could influence the health of people with conditions covered by Clark themes, many of whom might count as disabled, including mental health service users or carers, and which included the specific experience of those facing poverty, youth, ethnic minorities, refugees, lesbian, gay, bisexual and transgender people. Also, outreach could reach some, for instance, young people who might not attend an event, going out to where people are rather than expecting them to come to us. From what I read and heard, I produced a report and presentation, which was given at that one-day event, along with more information about some of the existing research and how people had been involved. Map making was carried out in groups, which identified some of the varied factors influencing health locally and began to consider research questions. Bringing together different types of knowledge and experience and recognizing inequalities as well as strengths in communities can make it possible to explore complex issues and how these might be tackled in ways that researchers on their own might not manage nearly so well. Just to say, there are no slides that go with this section other than the slide just giving my name and where I'm based. My other example is from 2020, in which
in that year, ARCs across the country, ours included, were preparing to develop involvement strategies. Then COVID-19 struck and everything was different. Much extremely valuable work was done on addressing the challenges of not being able to involve people safely on a face-to-face basis and dealing with the digital divide. But there were also other issues to take into account. The devastating loss and challenges made worse by inequality, as was powerfully expressed in an online event we organized at very short notice. That is the Equality, Diversity, Equity and Diversity and Inclusion lead, Josephine Oklu, and I, in April. Public contributors and community activists were sometimes personally affected, as well as having competing priorities, often linked to survival. As the strategy developed, we offered varied ways of feeding into this, for instance, through widely distributed e-newsletters, as well as contacting the existing contributors directly. So there were questionnaires, including a question on equality and diversity, though it was a key theme in many answers to other questions, and small groups at an active involvement in research event, this time online. Then there were workshops and a diverse working party made up of staff and public contributors to pull together the strategy. It wasn't perfect, but EDI is often not about perfection, but doing what we can. Having flexible ways of being involved increases the chance of broad input. Planning and resourcing involvement is important, but above all, willingness to work collaboratively. Thanks. Back to Linda.
Thank you, Savi. That was really comprehensive. Thank you for that. So next slide, please. So in this section, I'll just briefly talk about the additional resources that we've used to create this presentation, but also resources that you can refer to and learn more about incorporating EDI to PPI. And as I mentioned earlier, if you do have a chance to complete the webinar survey and leave your email address, the presentation along with the hyperlinks in this resource in the presentation will be sent to you. So the first one is in the Include project, which I mentioned earlier, that provides the tools and roadmap to improve inclusion of underserved community groups in clinical research. They do have their own dedicated website, which includes the framework. We also have a guide to create an inclusive content and language, and this provides a guidance to write to support you in writing more inclusively. And then the third is different experiences, a framework for considering who might be involved in research. This NIHR guidance helps to aims to help researchers include a diversity of relevant views and perspective. Then we also have the main document we advise in terms of researchers, NIHR's briefing notes for researchers. This is gives you sort of an overall guidance in terms of PPI in research, and there's also a link to that document as well. Next slide, please. There's also the Research Design Service. The service provides support to researchers in developing and writing an application, and also support in terms of PPI. I know that they are hoping to publish the EDI toolkit early next year for researchers, and the people in the team can be contacted. As I said, we will also send you the slides containing their contact details, so they can be contacted, and I've included their email address on here as well. And then there's a Learning for Involvement, which is the main NIHR's website, which is dedicated for patient and public involvement, which includes a list of resources on PPI and EDI and various guidance, videos, articles, and blog. Again, this link is also included in the slides that we will send to you. Next slide, please. And then lastly, we have People in Research, which is a dedicated website where researchers can place opportunities to find members of the public who want to be involved in research. Next slide, please. Okay, so now that we've actually talked through, gone to the the various resources and in our presentation in terms of incorporating EDI and PPI. I would just like to see if you are feeling more confident. And so we'll run a poll, which is the poll we used in the beginning of this webinar. So if you could pull the poll up, please. And just to say, how confident are you incorporating EDI to PPI? So it has been an improvement. So as attendees have stated, you know, we have 37% saying sometimes confident, 31% saying fairly confident, and 22% saying slightly confident, and 4% saying very confident. So thank you for completing the poll. Onto the Q&A section, so we can stop sharing. And I'll be hosting the Q&A section. So this will be an opportunity to ask questions to anyone in the panel, or, you know, I would select a question. I think, okay, it's perhaps more appropriate for a public contributor to answer. But I also want to say if there's any questions that we cannot answer today, and I'll tell our comms department to put this on the chat, if you could send your questions to publicrecruitment@nihr.ac.uk, and then we'll be able to get back to you. So I will now go on to the Q&A and read the questions that have been most voted for, and then present that to the panel. So the first question, there was already a question on there, but that has already been answered in terms of top tips. So thank you for Sylvia for answering that. So I've archived that question. So I'll go on to the next most popular one. How do you reach out to underserved communities? And then how do you convince them that it's worth them taking part? How can you make these communities trust the researchers and related charitable organizations? So I can open that to the floor. And yes, thank you. The comms department just letting me know that if you want the slides, just to leave your email address. Would anybody be able to pick that up? Okay, I will start. So Savvy.
Okay, I'll start the ball rolling. I think one of the issues is about trying to involve those underserved communities, and in particular service users and carers from those, in thinking about what is researched and why. So in building relationships, as far as possible, if groups have a role in setting priorities and research questions, they're more likely to be involved on a longer term basis. And I recognize this can be challenging because of the way that funding is organized and other aspects of research culture and practice. Other issues include building relationships and keeping people in the loop about what you're doing. For instance, if they've made suggestions, what you're doing and why not, following in from one of the points that's been made earlier. We have a quarterly involvement e-newsletter that goes out to a range of local organizations where we intentionally try to get a fairly diverse database reflecting some of those different sections of the population who may be more likely to experience health and care inequalities, and trying to show yourself to be trustworthy, reporting back, having public contributors and local community organizations having a say, for instance, at seminars, if they have been involved, then making sure that that's prominent, and that will encourage others to get involved as well. I'm not underestimating the challenges, but I think it can be a longer term issue, but there can be some quick wins, and I think there are a lot of examples of good practice around.
Thank you, Savvy. That was really, really comprehensive. Does anyone want to add to that?
Can I just say this issue about commitment is important, which Savitri has mentioned. If you have to commit to the relationship, if you like, people can see quite easily if they want to wheel you in as the token group or whatever, to tick a box. And I think very often, particularly underserved communities, get very suspicious unless they are involved more genuinely. And I think the points that you've made there need to be stressed. You have to develop a relationship with the people that you want to make sure are involved.
Thank you, Angela. I think that's quite important. Anyone wants to add to this point? Silva.
I think also using existing connections might be a good way to facilitate that initial contact, but then I agree completely with what Angela and Savi are saying, especially around continued communication and providing feedback as well can help kind of build and maintain that trust as well.
Yeah, Savi.
Yes, and tying into that point, valuing diversity within the staff team. And again, I know that that's a challenge in the research world, but the more reflective local staff are, research staff in general, of the local population, especially those who experience health and social care disadvantage, and also the more confident local staff are to talk about their own experience, draw on their own contacts, recognize that many do have links in local communities, the more chance there is of building up those relationships of trust and tapping into sometimes word of mouth or other chains of communication within local communities or among local service users and carers.
Thank you, Savi. I just want to say I agree with all the points made, Silva, Angela, and Savi, in terms of the building trust. Another thing I just wanted to add in relation to this is how can you convince them that's worth taking part? I think that's a really crucial question. I would say, for instance, if there's a research you're doing and there's a high prevalence of disease in that community, you can say, look, I'm doing this research, say, for instance, on type 2 diabetes. I think it'd be quite useful if people from a particular ethnic minority take place in this research. Again, that's saying to them that, you know, it's about making sure that your voices are heard as well, and not just the usual people that get involved in research. So I think that's a very important point to raise. So I will now go on to the next question. Can you give some concrete examples of a research study where there was good representative EDI? And again, how did you do it, and how did you actually recruit people? What were the challenges? So Savi, I don't know if you would have, in terms of being a research staff, if you would have an example of this before I come in.
Yes, I mean, I think there are quite a number of examples that I could give, for instance, around our palliative and end-of-life care theme, or some of the work that has been done by our maternity theme. Again, I think it's been very much a matter of building up examples and spaces where involvement is done. And sometimes this may be easier if your particular research team is part of a wider group or network. So building on existing groups and networks can be important. I think creating that space for people to have a say, trying intentionally to increase diversity among those who are involved, and recognizing those different insights, and making sure that people get that involvement recognized, for instance, in publications, but not on a tokenistic basis, and then continuing that feedback loop has been key to that, and then just using varied methods of reaching people within communities where activists are involved and become confident that there's something that's of value that can be helpful, and also tapping into what service user and community organizations have, but recognizing there are resource costs. Something that might seem quite small in terms of, say, a university's budget or that of a large research institution may loom very large in terms of a few hours of staff time or volunteer time in an organization, in a community that's under a lot of pressure. So if you can give resources to some of those who might act as intermediaries to help them to bring people in, as well as maybe resource them if they're holding outreach type events, then that can be, I think that's sometimes proved effective in getting more people involved.
Thank you, Savi. And let's come to Angela. Have you witnessed any, being a public contributor on the selection committee, do you know of any good examples of where you've assessed the application of good representation of EDI in terms of PPI?
From the point of view of being on the selection panel, I think perhaps the most resonating for me was it was a maternity case where the people involved were looking specifically at people's experiences with perinatal birth, and we had I could see that there was quite a lot of input from a range of women who had experienced had different treatment, different experiences, and were very articulate, I think, in the qualitative experience that they had. And I think that resonated not just the panel, but I think it was very clear in the report that the researchers had gone a long way to actually ensure that they were going to meetings with mothers and their children. They made sure that they were resourced well, that there was an issue around childminding, creche facilities, that sort of thing. I think that was the point I think Savi made, that the money spent, if you like, in trying to ensure that a whole range of people can take part. They have their own commitments, they have their own needs, but if one recognises that within obviously limited resources, that can do an awful lot to actually get people to participate. And that was one particular example.
Okay, thank you, Angela. That's really, that's quite a useful example. Thanks for that. So it's just good to actually see that in practice. So we can go to the next question. Meaningful PPI, especially with underserved communities, takes a long time to build. Takes a long time to build relationships and trust, etc. And resources to support PPI reps involved, and also time for researchers to undertake PPI activities alongside the research they do. How can we build in this time and resources within a normal application that is usually time and funding limited? Yes, I do agree with you that it can take a time to build, especially with a community perhaps that may not be as trusting in terms of engaging with research. And I would say in terms of taking time to build, I would say it's important to start, quite early and see if you can identify community champions in that community. So like religious leaders or just community organizers. And I think you can start from there, is trying to build that relationship with those people, and then that can be filtered down. And that would be my advice. But I will come to anyone like this. So Sylvia.
Yeah, thank you for the question. I think it's really important. And actually that exact question about, well, time and resources and funding for this is exactly one of the questions that we at the Centre for Engagement and Dissemination are trying to tackle within the area of focus. I said that EDI is one of 5 key priority areas, and actually one of those sub-questions is, how can we better support researchers with specifically kind of time and resources in mind? We're still trying to understand how to do that, but I think that preceding that, there should also be maybe more work done around kind of raising awareness and kind of changing cultures, even within NIHR, within organisations, around the importance of this. And I wanted to flag one NIHR initiative, which I think is trying to do that, which is part of the NIHR's Race Equality Public Action Group's work. So obviously it's focusing on race, but it's a kind of a big part of EDI work. And it's their work on piloting a race equality framework, which is, as I said, kind of in pilot mode now, but they are seeking to use this framework to challenge organisations to look at their current policies, guidelines and ways of working around EDI to hopefully kind of improve on those processes. It's hopefully going to be kind of rolled out more widely in spring 2022, but I think that's an example of how I think the kind of the culture needs to shift, and after that, hopefully then there will be an easier pathway to kind of thinking about, well, how do we account for time and resources to do this properly?
Thank you, Sylvia. That was very comprehensive. Savvy.
Yes, I think it's also important for those who are developing research proposals or taking forward plans to build in resources, including staff time for this. Involvement can't just be done as a kind of added extra squeezed in, because doing it properly does involve a fair amount of time, ensuring that people are adequately supported, that access needs are met. So there are also additional funding needs. Taking it into account in terms of the scheduling, and I know it's difficult because of the pressure to get research done and dusted very fast, but that, for instance, working with service users and carers, they may very well have health needs, or which may be variable, or be caring for somebody who does, which may mean that they can't be present at every meeting, or it may need to be adapted to their availability. So it's trying to build that into time planning, resource planning from the very beginning, and part of that is in encouraging senior staff to see how vitally important involvement is. And it's very easy for that to get squeezed, but the point is out there is, if people aren't involved in shaping the research, who are most likely to be affected by it, you may well be gathering a lot of information, but maybe the wrong information, or interpreting it in ways that don't actually make sense or aren't helpful, or unable to translate it into actual change on the ground, which would be possible if there were diverse involvement from the outset. So it's trying to make sure that those resources are built in, even though it can feel as if there are, a dozen other pressures on research budgets and timetables.
Thank you, Savvy. That's really comprehensive. Anyone else want to come in before I move on to the next question? Okay, so moving to the next question. This is very important. So this question is: we desperately want to offer pay regular to our contributors, but the systems in place currently make this nearly impossible to do so. The level of paperwork and bureaucracy make doing this inaccessible to most of our contributors. Is there anything being done nationally to offer guidance and process for this? Before I go to Silva, because she deals with payments, I know we do have, so the Center for Engagement and Dissemination do have a payment policy, a guide, which can be used for public contributors and researchers. So actually what I will do, it's not on the slide, but the slides that I actually send out, I will send a link to that policy, but I'll hand you over to Silva because she deals with payments at CED. She can answer this.
Yes, thank you for the question. I actually noticed that there were a few questions on payments in the Q&A. It is a tricky area, so I definitely feel your pain and absolutely agree that it is a barrier to inclusive, accessible, focusing on EDI kind of involvement. And to kind of answer with one of the other questions, I think that yes, university systems tend to be bureaucratic and inflexible, and I definitely do hear a lot of feedback from colleagues saying that the finance systems are often not fit for purpose. However, I do want to reassure you that there are examples of good practice, and what I'm actually doing at the moment is initiating a review of the guidance that Linda has talked about, and specifically I'm seeking case studies of examples of where things do work swiftly, efficiently. So I do plan to publish this as an annex to the new updated payment guidance, which is scheduled for spring next year. So do keep an eye out for that. Also, if you do have examples in your organizations where payments are being done efficiently, do get in touch, because I said I'm sourcing those case studies now. So hopefully that will give you more information. But just to give you an example, at CED, we have quite a simple form, an involvement form, a claim form that our public contributors fill out. And we have in our payment guidance the rate, which is divided by either an activity equates to an hour or 2 hours, a half day, full day, or beyond that. So we have our policy, and we have quite a simple mechanism in place with the form. Now, I know that some organisations require public contributors to be on payroll, query whether the nature of involvement is employment or not, what the tax liabilities are, and that's where things get quite complicated. So what I've tried to do in our NIHR payments guidance is demystify some of those queries, specifically around employment status, which I know comes up a lot in conversations with both finance teams and HR teams within organisations. So I go into a bit of an example, a kind of a process to kind of understand what the status of public contributors are. There's also, I think, special attention needed where a public contributors are in receipt of welfare benefits, because that kind of offer of payment, if the public contributor accepts payment, that could impact their benefit status, and we definitely don't want that to happen. So I think a good starting point would be our NIHR payments guidance for information on that. As Linda mentioned, there's one version for researchers and professionals, which also actually includes more information about budgeting and stuff like that. But then we also have a version for members of the public, which actually goes into more detail about the welfare benefits status and upper limits for how much people can claim and stuff like that. But there's also work that I'm involved in, which is cross-nation. And so that's trying to actually do more kind of national kind of government influencing on this. So this is work that I'm leading alongside other funders in the UK, 4 nations, and the Republic of Ireland. And this came about because we recognised that it's not just a problem in England in terms of what kind of the questions in the Q&A said about bureaucracy and inflexible systems. It's not just a problem in England. So what we are doing is embarking on a project which will kind of pull together our shared understanding of what the problems are in the system, and we are producing shared practical guidance, again, to understand. We're specifically focusing on the area around employment status, because I think when we've identified that that's a real kind of blocker, especially when dealing with finance colleagues in organisations, and that guidance will hopefully help researchers or involvement staff like yourselves to have those conversations internally to hopefully overcome some of those barriers. And as part of that work, we're also trying to do some influencing at government level. So HMRC has quite a unclear and not very useful piece of a guidance on their website, which doesn't really help. So what we're trying to do is have conversations with HMRC to see if we can help clarify that information that could then help smooth the processes around employment status and tax around payments. So hopefully that will reassure you all that there is work going on. We definitely recognise that this is a very, very important issue to be tackled. It is a practical barrier, but often when I talk to people, especially in talking about working with diverse communities and focusing on EDI, it is one of the top barriers that we are encountering. So again, not surprised to see quite a few questions around that. So hopefully, yes, as I said, this will reassure you that there is work going on. So watch this space, both in terms of the update, the NIHR payments guidance, which will include information on examples, and also that kind of cross-nation work that we're doing with the other nations funders as well.
Thank you for that. That was really, really comprehensive. Thank you, Silva. And I just wanted to add to that in terms of, to say, I can only imagine how it must be as a public contributor. You want to get involved, but you're worried about your benefits being affected, and it's just so complex in terms of the different systems. And I also wanted to add, in NIHR Academy, we do also use the CED guidance on payment for public contributors. So it's very clear in terms of how much people are paid for their time. But before I go into the next question, I just wanted to see if Angela wants to talk from a public contributor perspective in terms of how have you found things about being paid to be involved, or any feedback you want to add on that.
Oh, thank you. Well, so many years I've been involved in it, I've certainly seen an improvement within or the NIHR, but I think there are obviously different issues with different universities, in terms of that, and still, real problems. One of the things that I'm concerned about as well as the issue around employment benefits and how that can be affected is support to carers, support for caring for children. These are the things, positive things that I think we should be looking at as well, to make sure that people are able to attend, because they have care responsibilities, and that's the issue. It's not so much the payment, it's who's going to look after their the person that they're caring for while they're at meetings. It's probably not an issue now, obviously, with COVID and IT, but I think there are some issues around that people need to consider even more so. I'm thinking particularly of carers and also mothers, young mothers who have responsibilities. If we can actually tap into looking after or doing something to ensure that they've got childminding facilities as well, and I think we'd get more from them.
Thank you, Angela. So I'll now move on to the next question. We are finding that translating materials and ensuring that people and ensuring people that don't speak English can participate is very expensive, and we are unable to accommodate all potential languages for whom it will be valuable to include because of the limited funds and lack of researchers speaking all possible language. Do you have any guidance on how to make this a fair and inclusive process while also constrained by these barriers? That's a very important question. I would say that, an example was given to me where someone was applying in terms of funding and mentioned this issue. And not to be discouraged, I would say if you have found participants who don't have who don't have English as a first language or need for the translation, I would say to put that in your application and then request more funding for that, but not to say not to feel that you cannot include people who don't have English as a first language and then exclude them from the research. But that would be my advice. Anybody who wants to add to this? Okay, but yeah, that's
to agree with what you said, Linda. Yeah.
Okay, thanks, Sylvia. So we can archive that question. Can we go on to the next one? How do we ensure EDI in projects? And should we ask how people identify themselves in terms of characteristics and ethnicities? If so, since these are seen as sensitive, especially protected data, there are potentially some barriers around GDPR and data sharing, particularly if you're working with researchers in a number of institutions. Do you have any guidance around this? Sophia, can I come to you on this in terms of how do we ensure EDI in projects, and should we ask how people identify themselves in terms of characteristics and ethnicities? But I mean, if we don't have the answer to this, we can always, like I said earlier, if you just put the same question in the public recruitment email, which is put in the chat, but I'll come to Sophia anyway, if you have an answer on this.
I hope you can hear me this time. Can you hear me?
Yes.
Good. Sorry about earlier on. I think in terms, especially if you're doing research around particular communities and you want to do some comparisons, and I think looking at the census data in terms of the breakdown, looking at the census in terms of looking at the breakdown of ethnicity might be helpful. So you're looking at, in terms of how ethnicities are described. Also, perhaps putting in the option where people may prefer not to say in terms of their ethnicity, because it is a sensitive area. But I think the other aspect is a lot of research is being done around looking at Black, Asian and minority ethnic communities. And as Angela alluded to before, there'll be some health issues or social care issues that there will be differences for different communities. So I think in terms of, in order to get a full picture, it's always good to sort of compare in terms of the different communities. And as I say, you might be specifically looking at a particular community. So I'd say I'd really encourage you to look at looking at across different ethnicities, or as I say, if people don't want to disclose, then they can, you know, have the option of saying they prefer not to say. So I think in terms of with equality, diversity and inclusion, if we're looking at inclusion, then it would be good to ask that question, because then where we know as researchers that you are being inclusive, and you can look at where the gaps are in your services and service provision, as well as in terms of where sort of nationally there may be a picture where there may be an overrepresentation of some communities. So for example, in the mental health system, there'll be an overrepresentation of some communities. And it might encourage you then to do more research in that area to address that area. So like I say, a starting point might be the census in terms of how ethnicity is identified, so you can compare it to that.
Thank you, Sophia. That was very, very comprehensive. Savi.
Yes, I mean, I think there are differences in terms of gathering information for participation and for involvement, because of course the number of people that there might be involved in, say, a steering group for a particular research project or theme of or area of work may be a relatively small number of patient service users, carers and other members of the public, and indeed of researchers. So I think it's a matter of sometimes being very clear, if you're gathering the data, who's going to have access to that information, and how it's going to be used. Is there going to be a breakdown given? Is it going to, and if it's a breakdown in terms of fairly small numbers, then of course that it may disclose things about individuals, because if there's a project and there are 3 service users and a carer on the group, and we get the data that, you know, there is somebody, one person who's Sri Lankan, one person who's a mental health service carer, one person who's a lesbian, and so on. And they're 4 public contributors. It may not be absolutely impossible to guess who is who if that information is provided on a very granular basis. So I think it's thinking carefully about how the information might be gathered. Is it just going to be one member of staff who gets it, or will all the research team who are working alongside these people have it? Should they then have the data about the members of staff they're working with? So there may be issues around power as well. But there might be, for instance, an involvement coordinator or some other member of staff, admin staff, who may gather all this data, may be held in confidence. It may be broken down only in much larger numbers, or studied to make sure that people from diverse backgrounds are being involved where they ought to. Yeah, so it's just giving some careful thought to what should be asked about and how that should then be used, and ultimately how that information is stored and, you know, destroyed if it's no longer needed.
Thank you, Sabi. That's really comprehensive. So does anyone want to comment before I go on to the next question? Okay. No. So this is a very important question, I'd say. Have you found ways to engage inclusively with people who experience digital exclusion? I think this is really important, especially in these times where there's obviously restrictions, you know, people not meeting face to face. So it's important, you know, even just doing our things like our webinar and our conference, you know, everything's being done online. I know we are working on a number of projects, but just to my knowledge, I can't think of if we are specifically working on one in terms of digital exclusion. Sylvia, I don't know if you know. No. But yeah, I would say it is an important question, and it's something that we all need to think about. I think there's just a generalization sometimes that people feel that everybody is digitally enabled, and that's not always the case. And it's just something that we really need to focus more. Does anyone want to come on this question? No. Savi.
All right, I'll start the ball rolling on this again. I think it depends on whether people have been involved before, in which case, for instance, it may be easier for them if they're joining by telephone, if they know members of the group, to do that. But if some people are joining by telephone and some face-to-face, you may need to say people may need to say who's speaking if you're speaking and not everybody can see who you are. There can also be ways of helping people who may be just about able to use digital technology, but they may need some support. They may need extra funding or advice on how to make their device work. The costs of data being paid, or other kinds of access issues. Having, working with organizations can be important. It's not ideal not to be able to involve everybody, but it is certainly better to talk to organizations that might be working with people who are digitally excluded than not touch base with people at all. And again, it depends very much on the specific situations, but it is a challenge in that a lot of people who are digitally excluded may also be at high risk or very high risk in terms of COVID. So it's not putting people in danger, but at the same time trying to make sure that diverse views are still gathered.
Thank you, Sarah. Yeah, I just wanted to also add to your point. You're right in terms of using the dial-in option. Very often with meetings in Zoom or various platforms, you can actually, dial in. So not to forget that, in terms of making sure that people who are digitally excluded can still engage. So perhaps also having an option when you do any times of PPI online, that you also have a phone-in option. That's another point. Okay, thanks. Move on to the next question. Are NIHR willing to be more flexible with funding limits in order to build in more costs for PPI and EDI? Often projects need greater staff capacity, facilities, and resources to be inclusive, and this can be stifled by low funding ceilings. Yes, I do agree. But similar to what I said earlier, I would say if you do in terms of your when you write your application, you feel not to exclude certain groups, you can't just put in the application, I would, in terms of funding, I would require a translator, or I would require extra resources to enable diverse people to take part. That would be my, but I do agree with you in terms of, because it can require more resources, incorporating EDI. Does anyone want to add to this comment? No, this question.
Yeah, just to say that it's something that I recognize as well, and it's not the first time I've heard this kind of challenge and this question. And I think that hopefully what I was saying earlier about kind of a cultural shift towards accepting kind of EDI in grant applications more widely will hopefully kind of justify those costs more.
Thank you, Sylvia. So I'll move on to the next question. What are NIHR's thoughts on having a dedicated person within research institutions, academic settings, whose sole job is to build relationships with various communities and groups and match them with relevant researchers and research projects? More times than not, researchers know and value PPI and EDI, but we are under-resourced and under strict time pressures, which limits us, which limits our ability to develop genuine links with those we wish to serve. Yeah, I really think that is a great example. It's something that I can feedback. And I do think that it's very, very important, almost having like just like I mentioned, like having a community organizer, but I suppose this person will be dedicated in research institutions and can be the go-between between researchers and participants. But it is a very good point, and it's something that I would actually feedback. I see if I can actually just copy that now and make sure that I feedback that to our program teams.
I think the issue, Linda, if I can
Yes.
just say,
Yes,
is
please come in, Angela.
having somebody who is able to have a resource, have a wide resource we have, for instance, in Manchester, and I think other people should have as well in other areas, because I think it's funded through ARC, but it's the public, PCIE, we call it there, and it's where there are people from a wide range of organisations, voluntary as well, who can give their thoughts or listen to presentations, but also the person that is responsible for convening that group is the person who can identify the right resource. Do you see what I mean? So it's not, I misread the question initially, because I thought you can't have one person who, you know, is master of all and knows all the different groups, and, you know, there will be a dynamic that's going on there. You need somebody who's able to actually foster, develop, and be in touch with a wide variety of communities.
Yeah, I think that's a very important point, Angela. And someone mentioned about involving the research design service. That's another important point. I know they're launching their EDI toolkit early next year, and they do help with PPI in terms of application. So yeah, I will also liaise with them. So thank you for that. So we can go to the next question. It would be important to think about involving people with learning disabilities in PPI groups as well, and not just for research that is only about people with learning disabilities. Definitely, I definitely agree with this. It is important, and making sure that we just don't say, okay, this is a research on learning disability, but there's a wide range of research. Again, probably need you might need sort of more support, for instance, maybe also producing materials in easy read, you know, but yeah, I do think that's a very, very valid point. And does anyone want to add to this? Sam, did you put your hand up?
Yes,
Yeah, okay.
very much. Producing accessible communication, finding out from each person what their particular access needs are, because one size fits all won't work. Possibly giving a bit more time for meetings. If somebody needs a support person to help go through materials before and afterwards, then building that in as well, potentially. And somebody may have an existing personal assistant, but may need extra resources for that additional piece of work. So it's very much tailoring it to each person, and certainly valuing what everyone can contribute when they're involved.
Yeah, definitely, I agree. So yeah, I think that we can archive the next this question and the next one because it's similar. And the next one, please. Okay. So this would be our last question because of time, and this is a question for Angela. It's quite long, but I read it. We have heard today guidance on what researchers need to have in mind and ultimately in practice when reaching out to underserved groups. In your experience, Angela, perhaps using diabetes as an example, what is the general understanding of this condition amongst local communities you've worked with and represented? I ask this because without some form of knowledge and understanding of key public health issues, promoting PPI will mean little if the core subject is not fully understood or appreciated. I work in Nottingham with gastrointestinal and liver function of the BRC, so Biomedical Research Centre, as a PPI lead. I feel before we truly reach out, I would want to know the extent of knowledge and appreciation of any given condition is known before I try and promote PPI. Your insight would be extremely useful. Thank you.
Ooh. I think, well, I've had personal experience because of the issues. I think I said at the very beginning of a close relative who was elderly as well as type 1 diabetes, and a lot of the issues that were raised were because there was very little understanding of her lifestyle issues around feeding, food, perhaps, you know, her lack of understanding of what's good and what isn't, and also some forms of food and cooking that the practitioner wasn't aware of. That has developed a bit since then. That was about, oh gosh, yeah, some years ago when I was involved in that, but that has improved. But I have to stress that you can't see this in isolation. What we're talking about is how we actually discuss and debate with various groups within an area, and so it's all about relationships with parents who are responsible for children, relationships with the person who is responsible, if you like, for the religious guidance of a group, maybe. It isn't just, well, we want to do something about diabetes, so we need to talk to you. I agree with the person who's asked the question. You have to actually understand and actually get into a conversation with the communities that you're dealing with about their lifestyle, and their issues that are important to them. Things aren't going to work unless they understand and trust, if you like, the conversation that they're having. I'm sure Savi will, from a practitioner point of view, would make that. But certainly as a carer, as a user, I tend to find that things don't work unless you're actually having rounded conversations with the community. So I agree. You have to understand, and you have to have a discussion with the communities about things that are important to them.
Thank you, Angela. That's really comprehensive answer. And I'm just for the interest of time, so I'm just going to quickly close up. I want to thank Savi, our research staff, for attending today. Thank you so much for your feedback. I know you have to go quite shortly. I also want to thank Angela, our public contributor. It was really valuable having a public contributor perspective. I want to also thank Sophia, our EDI manager. Is really important in terms of you explaining what EDI is and being able to answer the EDI question on here. And lastly, I want to thank Silva. It's been really a pleasure working with you, Silva. So thank you for working with me in terms of putting the slides together. Really, really appreciate it. And I want to thank everyone for attending. And as I said, I really, really encourage you to complete our webinar survey. It gives us a chance to improve our webinars going forward. And in that webinar survey, there will be a link for you to leave your email address if you want to receive the slides to all, which includes all the hyperlinks and resources we've mentioned. So thank you everyone for attending, and take care.
Bye. Thank you.